And with me also from Heart and Health is Dr. Happel. Dr. Happel works also with Dr. Cavestein, who you'll see later on in the program, as well as Dr. Farman-Poor. One of the things, Dr. Happel, we didn't get too much into with Dr. Farman-Poor was this OMD type of thing. I'll leave you for you to pronounce it because it's a really long one. Tell us, what is it?
Okay, so OMT stands for osteopathic manipulative treatment. And what we do is we're able to assess the musculoskeletal system, because we are DOs, which is doctors of osteopathy. And we're able to find areas of restriction or strain or patterns where you have maybe a tight muscle, and able to use different techniques to treat those pains. So we treat ailments anywhere from like a regular headache. So it could be, is it a tension headache? Is it a migraine headache? Is it a sinus headache? You know, a lot of times we'll bring a patient in if they have a sinus infection and they need either antibiotics or oral steroids. We'll bring them back and do a sinus drainage technique to help promote the drainage of the sinus cavity. So we really treat anything from pain syndromes to infections. Patients that have asthma and maybe they're having restrictions with their breathing, we're able to do some rib raising techniques, nice gentle techniques just with our hands to help promote the body's health.
Now you get a lot of people who like stand up, they're on their legs a lot. That causes, again, lower back pain and stuff. Now, is this kind of like chiropractic, or is this like totally different area of medicine?
Yeah, this is a different area of medicine. It is a manual type medicine where you're doing treatments with the patient. So it's, in that sense, it's similar to chiropractic. But the osteopathic philosophy is more of being able to assess the musculoskeletal system and being able to see what's not in harmony, what's not symmetric, and trying to use techniques to put your body back to its normal symmetry so the body can heal itself. So our philosophy is a lot different. We don't bring patients back more than once a week, you know, for treatments that you'll oftentimes see chiropractors do. Because we want the body to be able to adjust and adapt to the changes that we've made during the treatments.
So it's a much more natural way of going on it. And analyzing the structure of the human body, sort of like checking a bridge to make sure the structure, all the beams are okay. Everything's where it should be. As we know, is when we get older, sometimes things fall out of shape or never come back to where they belong.
Right. And, and if our posture is bad, you know, so if we're sitting at a desk and we're doing the hunch over on the computer, we get a lot of that neck and upper back pain, and you can get headaches just from that strain as well. So trying to retrain those muscles, not just with our treatments, but we'll give you a little bit of homework and give you some stretches to do to try to retrain those muscles.
Now, you know, it has to do with your occupation too, which Dr. Farman-Poor had just touched on briefly. If you're somebody like a woman who's on her legs, you know, constantly standing on her legs all the time, compared to a construction worker who's swinging with his mallet or sledgehammer or whatever like that, you're going to have different stress points on your body and different pulls and tears on your ligaments, right?
Absolutely. And not just the physical stressors of your occupation or, you know, even just being like a stay-at-home mom. You know, you're running around, you're picking up the kids, you're doing a lot of housework. There's a lot, no matter what you do day in, day out, physical stressors can affect the musculoskeletal system, but so can emotional stressors. And, you know, women and men carry their stress a little bit differently. Women typically, as a woman, I could say we carry our stress more in the head and the neck area. So a lot of times, even if physically we're doing okay, mentally we're not, and that's where our stress points will be.
And we had seen some footage before of you actually, you know, doing one of these manipulations with a patient. And you also did this thing like behind the shoulder blades. There was this thing. Did you find a lot of like, you know, pulls and tears in there? Or?
Yeah, actually what I'm doing in that segment is I'm assessing the first rib, which a lot of times if it's either too elevated or too depressed, depending on how the muscles are pulling on those ribs, it can lead to, a lot of patients will come in with, oh, I have shoulder pain or I have neck pain. Upper back pain, and a lot of times that first rib is the main culprit. So if we can get that to move more symmetrically and work with the other side and that first rib, a lot of times we can help to ease that patient's pain.
Okay. We'll be right back on our next program with Dr. Happel. Stay tuned.